Thank you very much. Thank you very much for coming. And it's nice to sort of try and create a link between movement disorders and remote and extreme environments, and you can. I think it was about that finer passion and try and develop something quality in your sort of area and make things sort of flow backwards. So I think there might be some sort of link there. So my name's Edi Albert. Had a fair bit of to do with ACRM in the past, but not recently, because I've been stuck in northern WA working retrieval and remote clinics for the flying doctors. And if that wasn't enough, somehow I've managed to keep a job with the University of Tasmania, mainly because Jeff Ayton says I can't give it up. Most of you know Jeff Ayton as past president of ACRM, who for the first time in about 3 million years hasn't been able to get to the conference. And also as Chief Medical Officer of the Antarctic Division. So what I'm going to take you through is a sort of, everything needs a kind of a corny title. So these are a bit quite, yeah, so our corny title is Working on the Road Less Travelled. And what I'm going to talk to you about today is not so much rural medicine, not even so much remote medicine, but what's on the other side of remote medicine. So purpose and context, a bit of the background, the sort of journey we've been through over the last sort of decade or so, a little bit about curriculum content and the sort of the gaps that we're trying to fill, I guess, in education and practice, and then looking to the future. I think I'm going to try and change to the mouse because that thing's too fancy for me. There we are. So talking about beyond normal remote and into extreme environment contexts, looking in the same way at what's the extended skill set that you need if you're going to work on your own or in a small team in a very austere, remote, very extreme environment. And we're looking at some overlapping contexts. Clearly, we've got a link with the Antarctic Division. They've been a collaborator from the beginning. We've got some Antarctic doctors in the audience who've been subjected to some of this already. But also, I think one of the things I do like, and particularly coming to this conference, is you don't just see ordinary medicine and ordinary doctors. You see a lot of altruism. You see a lot of people being very generous with their time, with their money, with their ideas. So one of the things I do like, although we can wrap this under the label of sort of sexy expedition, Antarctic kind of stuff, a lot of what we do and the training, the education, is going to doctors, nurses and paramedics, because this is a multidisciplinary program. It's not just doctors, but these are people who are often taking their skills into a voluntary humanitarian sort of charity kind of setting, and I personally find that really quite a rewarding thing to be part of. But then also the other context, sort of scientific filmmaking, what I call playing type expeditions, military, the resources, natural resources industries are often in very remote and difficult sort of environments, certainly in Australia, but in Siberia, the North Slope of Canada. And part of what I do at the moment, going into tiny indigenous communities. So there's a lot of overlapping context for what we're sort of doing. What we're truly trying to do is sort of extend people's skills and fill the gaps where the ordinary remote training doesn't quite cut it. This is really one of those busy slides. I don't really want you to necessarily just sit there and read it, except to see that there's some sort of concept, some sort of progression, what we've called a visible pathway. Jeff and I were sitting at the back of a plenary at an ACRM conference probably about 8 years ago now, and we're bored to tears. Unfortunately, that actually hasn't happened at this conference. The plenaries have been good. And we got out just a napkin and a pencil. We needed to sketch out how do you, at the time there was a huge recruitment problem in the Antarctic Division. You couldn't get doctors for love and money. And so we sort of scoped out, what do we actually need? We need a visible pathway. Young students need to be able to see what they can do as young doctors, where they can go, how can we get the sort of specialist training required for going down to Antarctica, tailored into a program that gives them fellowship of ACRM, for instance, and then what sort of additional courses can we put in? We started the expedition medicine course that I'll talk about a little bit. Some of you may have come across that before or been subjected to it. And then sort of more sort of recently, how can people that are going into the Antarctic for 18 months come away with a higher degree that's got some sort of meaningful applicability, helping to build their careers afterwards. So although this was developed with the Antarctic Division, it was not purely for the Antarctic Division. and as I say, for doctors, nurses, and paramedics. So the first product we got off the rank was about 12 years ago, the first practical courses in expedition and wilderness medicine available in Australia, and that now has been folded into the university program. And then we sort of set about trying to identify what's sort of missing in conventional remote medicine training. So we looked at what we were doing on the expedition medicine course. We looked at the pre-departure training that the Antarctic Division offered. We kind of figured that they might have learned something useful after about 40 or 50 years of doing it, that there was some valid curriculum content there. We looked at the AST in remote medicine, some of the big heavy-duty textbooks in wilderness medicine, and came up with a sort of a program that really just does sort of try and fill the gaps. The modern world, I mean, I find it a bit crazy today. Chris at the beginning is telling people about how good it is and all the wonderful conversations going on online on the app. Well, that's all very good, but I came here to talk to people, to talk to real people in a real old-fashioned way. And that's true of how we do education. Online education has certainly taken off. I can see the benefits of it. I'm now involved with it. Do I really like it? No, I think, but it's what we do. But typically, critically rather, with this program, it had to be practical. It can't just be online. There's stuff you just cannot do online. So battling the university with sort of mixed course delivery methods that they don't understand. And as I've said, remote medicine is multidisciplinary, and extreme environment medicine most certainly is. And we do a lot of things around prevention and planning and the sort of non-medical skills on the basis that if you can't survive and thrive in that environment yourself, you're not going to be any good to your patient. So the program sort of grew as a stream within the Masters of Public Health, but finally, as of next year, 2019, we've wrestled it out of its wrongful bedroom, or whatever you want to call it, and it's got its sort of own entity as a grad cert, and then hopefully soon to be a graduate diploma. So we've got a number of different units. They're all sort of written there, and I'll kind of wander through the sort of main features of what we're trying to do. So with medicine and extreme environments, we look at cold and high altitude. Why do tropical? JCU does that very well already. Why compete with them? Why not just fill in the gaps, as it were? So we look at the main extreme environments: cold, high altitude, desert, maritime, underwater, and aerospace. We look at the challenges of working, surviving, thriving in those environments. Yes, I'm afraid there's some physics, and yes, I'm afraid there's some physiology. And we use some case studies really to try and sort of illustrate a lot of that material. And linked in with that is another online module which we call Operational Aspects of Healthcare in Remote and Extreme Environments. And particularly as doctors, we're really quite privileged and quite, how should I put it, we just kind of wander. I'm sure you've all done locums where you just sort of wander into the hospital and you put your bag down and you start work. That's all very well. Things are set up to work around you or not work around you. But how do you actually go about setting up your own facility in an austere environment? How do you design it? How do you run it? Suppose you're the only one. How do you actually, what decisions do you make? So we go through things like point-of-care testing. There's more than just iStat. We look at telehealth, and certainly some of the provider downstairs using the tablets for sort of remote consultation. That's sort of technology that can be built into telehealth. We look at disaster planning, evacuation, and we do it through the eyes of a few different case study sites, one of which, it won't surprise you, is in Antarctica. And we look at how different settings, different contexts, different funding models require different solutions. There's no one size fits all. But the idea is that you can come away at the end of this module with some idea of how to set up and run your own facility. We've got some other human behavior in extreme environments. The more I do and delve into this and the more time I spend out there, the more I realize that actually what goes on inside our heads as individuals and in our colleagues and our patients is probably more important than anything else. And we also offer a module in practical skills, which is the sort of stuff that the Antarctic doctors have to learn, and you think, well, actually, that's kind of what all of us in remote areas should be able to do. We should be able to use ultrasound. We should be able to take x-rays. We should be able to do some basic musculoskeletal stuff. We should be able to do some basic dental stuff, the sort of stuff that we don't normally learn, the sort of stuff that we don't normally get taught. Having said that, ultrasound's become pretty mainstream, but it's still there. And then the new one's exciting one, humans in space. And when Jeff first mooted this, I kind of thought, oh yeah, right, whatever. Yeah, okay, I guess it fits. Yeah. But I guess he was quite right. And with Roger Cable, we're now working, who's the senior RAF doctor and the sort of main educator at the Australian Aerospace Medicine Society. We're now running courses in humans in space. We've got Australia's got its own space agency. That happened a few months back. And there's already a lot of research, a lot of technology development, a lot of biomedical stuff happening in Australia, space analog research that's been going on. So it may suddenly crop up and you go, huh? Doctors in space in Australia, right, in Darwin? But it's one of those growing areas, and we decided that we kind of needed to be sort of really in at the beginning and be able to provide something that nobody else was doing. So I've actually found that the space stuff's quite interesting. I've learned quite a lot, and typically it's a bit like war. You know, we learn a lot of our civilian stuff from war, and we've had a lot of technological benefits that have flown back into healthcare from developments that have happened related to space. The other hopefully exciting thing, it's that sort of nodal thing that Ted was talking about, is the setting up of a centre for Antarctic remote and maritime medicine. That'll be a national centre. We're still scrabbling around with the sort of funding and quite how it's going to operate in reality. But the vision really probably over the next decade is that we have a real and virtual centre that can focus on some vocational training and remote supervision, that's helping to give the benefits that there's a certain difficulty with providing healthcare to remote environments, but the advantage can be that your funding model's quite simple. Someone pays you the money, go and do it. So you've got a lot of freedom that you don't get in normal healthcare. And one of the frustrations, in a sense, of coming to a conference like this is seeing all these good ideas and then trying to take them back into the real world of medicine, where there's a lot of ignorance and a lot of boring people and a lot of no ability to see outside the box. So again, but the hope really again over time is to look at some of the more innovative models of healthcare that we can use and are using already in maritime and other extreme environments, and to be able to use them in conventional healthcare. And then down the track, a bit more sort of research. So that's CARM, the Centre for Antarctic Remote and Maritime Medicine, that will get born fairly shortly. So where to next? Hope to have some more units up and running. I'm not sure whether it's extreme sports medicine or extreme sports medicine, but working with a sports physician at the moment to get another unit in that up and running. So again, learning about how we deal with people in extreme environments, how we support athletes who are working in extreme environments or doing extreme sports, and the learning that then can flow back from that into just treating everyday patients as well as being a sort of sexy thing. And then looking at trying to get another expedition type medicine course of medical care on offshore and inland waters, and beginning to work with the military to sort of make that all happen. And then if you've got a diary that stretches into 2020, most of us don't, we're hopefully looking at having the first National Extreme Environment Medicine Colloquium in Hobart. So I was going to bring leaflets. We don't do leaflets anymore. You just take pictures of things, don't you? And I haven't got a cue card, but you can take a picture of the URL and then you can type it in, and you don't need a leaflet. Thank you. What's it cost? 5 minutes. I've got 5 minutes to answer. What does it cost? So we've moved to a full fee paying model, which I think is appropriate for healthcare professionals. If you're working for the AAD, you're going to get it free. If you're working in Tasmania's public health system, then you're certainly going to get a discount. But you're talking about roughly $3,000 for a unit. So that's, what, $12,000 for a certificate. Expedition medicine course is a little bit more because you've got food, you've got transport, you've got accommodation. I recently did an Australian Institute of Ultrasound course, and I'm not knocking them, I think it was great. I was talking to Kim before. That was $3,750 for 5 days, and it didn't include the accommodation and the transport and the da-da. So the answer is, when you look at what other medical courses are costing, I think what we're providing is actually very good value for money. Yeah. Yeah, so we've had to certainly get med students that will come on the expedition medicine course, and as long as they've got a significant first aid training beforehand and some outdoor experience so that they're not floundering with everything that we're doing, that can work. But otherwise, it's certainly it's postgraduate for sure. Because we're sort of filling in the spaces, people are going to come in at different levels and leave at different levels, whether they're a doctor, a nurse, or a paramedic. We're not really in a position to change necessarily the scope of practice. If you can't intubate before you come on an expedition medicine course, you're not going to be intubating a patient afterwards. That's not what it's about. But yes, as a general rule, I find it's not unusual to have maybe an RMO that's doing this, and they're struggling because they aspire to go and work in a remote environment, but haven't yet. And it's going, well, go and do it. Get some experience, and sometimes I get some nurses and paramedics that have been out there and done it, and they kind of get it. So a lot of what we're doing is, it's around lateral thinking, it's around improvising, it's around stuff that you all in the room know is the difference between metropolitan medicine and rural medicine, but just taking it a bit further. So look, that's a hard one, isn't it? If you're really, really interested, you want to learn it, learn it, but yeah, how long do you just do ordinary medicine before you're really ready to learn it? So I try and sort of turn doctors away until they've had at least a couple of years. Yes, over there. Sorry? Is the certificate available now? So if you're already enrolled in the MPH program, anything you've done, you can carry forward into the certificate. You can roll it forward. Enrollments are happening now, but it's available really from February 2019. If you come on our expedition medicine course in the summer, you can then count that. So you could start in December. So yeah, it's effectively live. There's a couple of students in the room, or people, how should I say, a couple of doctors in the room. Do they want to say anything about the experiences they've had? Or we'll take a question first, perhaps, sorry. Look, it depends. I mean, a certificate in general in Australia is the equivalent of 1 semester full time, or sort of 2 semesters half time. But the way we're running stuff, the expedition medicine course is 8 days, then there's 1 assignment, so you can smash it quite quickly. Yeah, if you want to take a couple of semesters off and work part time and just smash it, well, you can. If you want to spread it over 2 years, you can. It's up to you. No further questions? I haven't quite got to my 5 minutes, so I'll disappear.